Welcome to Positive Parenting Childcare video. Diarrhea and vomiting are common among children. This video will help you to understand what causes it, how to prevent it, and what to do if it happens to your child. Diarrhea is the passage of loose stools which may be watery, and your child may pass anything from 2, 3 up to 10 or 15 times a day. The causes of diarrhea can be any virus, although the most common would be a virus called rotavirus, and it can also be caused by some bacteria. Diarrhea is commonly associated with vomiting and also fever. Now, diarrhea and vomiting can be caused by the organisms that I've stated. There can be other causes that will also mimic diarrhea and vomiting or gastroenteritis, and these can be associated with abdominal distension. Preventing diarrhea and vomiting involves cleanliness and ensuring that food preparation is hygienic, that you wash your hands before preparing food and after coming out of the washrooms, and also ensuring that baby does not put things in his mouth that may cause him to have gastroenteritis. The other method of preventing diarrhea and vomiting, especially if it's caused by rotavirus, is to give the vaccine, which is a rotavirus vaccine. If your child has got diarrhea and vomiting, it's important to replace the fluid that is lost in the stool and during vomiting. The main danger of acute gastroenteritis or diarrhea and vomiting is the baby getting dehydrated. And in order to prevent that, you must ensure that baby is able to take fluids orally. And this means that you give either oral rehydrating solution, or you give milk in small frequent feeds and make sure that baby does not vomit it out. Medication usually is not helpful. You may be given medication to prevent baby from vomiting, but any other medication is not of much use. The baby should be given oral rehydrating salts and should be given milk as far as possible. If you find that baby is lethargic or vomiting more than what he is taking in, it's time to see the doctor, and he may need other forms of rehydration, including using intravenous drips. How do you know when it's time to get medical attention? It's time to bring your child to see a doctor if he looks dehydrated. By dehydration, it means that the baby is lethargic, he's passing less urine, his tongue is dry, and when he cries there may not be any tears. These are signs of pretty severe dehydration, and no child should reach that level of dehydration. If there are signs of this dehydration or approaching these signs, you should let the doctor know, and you should bring the child so that he is seen by a medical professional and treated appropriately. I hope you now have a basic understanding of diarrhea and vomiting, why it happens, and what you can do about it. The next time it happens, you'll be more prepared to handle it better. Thank you and goodbye.